they are recording. And we have some quotes. I'd like to start this platform with the quotes. And before Bill reads the first quote, I'd like to say, this is a quote by Eli Clare. For a long time, someone I called my brother outlaw, but I can now call them my brother-in-law. And as my brother-in-law, he has taught me so much about disability justice. And I'm so happy to have found one of so many of his quotes that I could put into today's platform. Bill, if you would read the first quote.
Laugh and cry and tell stories. Sad stories about bodies stolen, bodies no longer here. Enraging stories about the false images, devastating lies, untold violence. Bold, brash stories about reclaiming our bodies and changing the world. Eli Clare, Exile and Pride, Disability, Queerness, and Liberation.
Thank you. And Phil has the next quote. Thank you, Bill, for passing the mic.
There is so much that able-bodied people could learn from the wisdom that often comes with disability. But space needs to be made. Hands need to reach out. People need to be lifted up. Alice Wong.
Michaeline.
This advocacy work, led by and for disabled people, is an example of the power that comes when marginalized people are able to advocate for themselves. Rebecca Barber, Nonprofit Quarterly, December 2023.
Thank you. Zeta?
With the COVID-19 pandemic taking a particular toll on seniors and people with disabilities, home care workers have been a critical lifeline. Despite the risks of COVID-19 infection for themselves and their loved ones, they've provided crucial care, support, and help to counter the acute social isolation many of their clients have experienced. From Home Care Workers Qualitative Study 2020.
And Fiona.
There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. Rosalind Carter.
Thanks. So, as a member of the society, we get to participate in different things that formulate what we do. And presiding is one of those things that one can sort of move into and towards. And I'm happy to have been doing this for a number of years. But each time is precious as I prepare to preside, because I work closely with the speakers and the topic, searching the quotes, thinking about the songs. Each time is sort of precious for that issue. So I want you to hear how passionate I am about this, I've been saying, but also the guests today. So Adria Powell is the CEO of Cooperative Home Care Associates. And some people in this room know that I'm very active in cooperative business development and cooperative economics. And Adria has become a friend. And we go back. Her mother and my mother knew each other when they both worked at CSS. In the years preceding the formation of Cooperative Home Care Associates, Peggy Powell was at CSS formulating this with some other people of how do we help workers who care for people have better jobs. And the co-op was one of those solutions, and 2,000 people are employed there today. It is in America the largest worker-owned cooperative that is also unionized, and it's in the Bronx. Some people know my friend Kathy Goldman, my mother's closest friend, who received care from CHCA a few years ago, which was a precious chance for me to make this connection as well. Bobbie Sackman, I got to know through the Brooklyn Women's Chorus a little, but I also then kept seeing her at demonstrations. And I'm like, I know you. So understanding more and more about the work that she's done over years as an advocate for people, seniors getting good care, having their rights, and really moving more and more into what is now called the caring majority. I want to just turn it over to them. I'm going to invite Bobbie up. Adria will be on screen. They will have a conversation. I'll invite Adria to introduce herself first. And we'll do this for a while. And if there's time for Q&A, we'll take it. But if otherwise, no one's rushing out the door.
don't do podiums.
Okay, just if you can hear, but I think Adria was going
Hello, everyone. I'm so grateful to be here, even though it's in Zoom. And I want to just first open up with one of my joys, which is to be here, but particularly to hear that Bev Grant is in the audience. Many connections, right? So interestingly enough, my stepfather, Frank Negron, who's married to my mother, Peggy Powell, who Rebecca mentioned, was in the human condition with Bev. So it was so wonderful to hear Bev's name. So yeah, today we are here on Sunday, March 16th, and 5 years ago, this was a Monday, and it was the day that COVID officially became a reality for us at CHCA. I'm speaking from CHCA's perspective right now. It just that Monday, no, that Friday, there was talk about possibly having schools shut down, and seeing what was going to happen. And true enough, 5 p.m. Sunday evening, the schools were shut down. The mayor got on TV, said the schools were shut down, and workplaces went remote, but not our workers, right? Our workers had to be there the next day. They were at work because they're home care workers, and that's what they do. They went in, they showed up Monday, they showed up Tuesday, they made sure that their clients were taken care of as we tried to figure out how we were going to survive the next days and weeks and months. And that qualitative study that the fourth quote was based on, I am so proud to say that we were connected to the researcher who did that study. And he was so incredibly moved by the home care workforce. And I'm actually really happy to say that he's continued to do work in this area, because there's not a lot of researchers that study home care workers, and the plight of the workforce that delivers this really critical care to people. So I am currently the president and CEO of Cooperative Home Care Associates, which is having its 40th anniversary this year. We started with 12 home care workers in 1985. And as Rebecca said, my mother was one of the original founders, along with Rick Serpin. And they founded Cooperative Home Care Associates because they really wanted to create a home care organization that was built on the pillars of quality jobs and quality care, the connection between the two. You can imagine that in the 80s and largely still today, home care work is not seen and valued in the way that it should be. So the jobs, were very exploitive, a lot of wage theft that was going on, low wage work, part-time work, no benefits, no investment in education and training for the workforce, no opportunities for advancement within the field, despite the incredible, skill that it takes. As we heard when one of the people sharing talked about, working with folks who are in hospice or who are dealing with terminal illness. It takes an incredible amount of skill and grace to do this work. But because of the sort of historical lineage of who did the work, women, people of color, immigrants, poor people, there's not an investment. And so CHCA was created to change that paradigm and change that narrative. And we work very hard to invest in our workforce and provide them with training so that they can deliver exceptional care to the people that they're serving, and that people are able to remain in their homes and communities as they age or as they are living with a disability or chronic conditions. And so, part of our work also is about changing the the sector and the field, and really gaining improvements for the home care workforce. And so we work together and set out on different campaigns to advance home care workers, to improve the quality of the jobs for our home care workforce. And we've done work over the years with the Caring Majority. Some of the pictures that you saw in the video in the beginning were around the Fair Pay for Home Care campaign, and really wanting to ensure that home care workers receive increases in wages so that they have family sustaining wages as they do this work. We continue to do work with the Caring Majority around these issues for workers and for the quality of the services that clients receive, and now are involved with the Caring Majority to address a crisis around the consumer-directed program. So I will turn it over to Bobbie and let Bobbie introduce herself.
Thank you. You can imagine the pleasure it is to work with Adria Powell, let me tell you, and her staff as well. So the New York Caring Majority is comprised of older adults, people with disabilities, home care workers, and family caregivers. And as that Rosalind Carter quote says, we're called the Caring Majority because we are the Caring Majority. So I thought what I would do is give you some really quick background on who is aging and what's going on in this city and state. I was just telling Becky this. There are 1.8 million people over the age of 60 in New York City. That's bigger than the whole city of Philadelphia, plus 100,000. More than 50% are people of color and immigrants, because it reflects the change that we've seen in the city's population. Almost 20% live in poverty, and that's government standard poverty. They're hanging on by their fingernails. This is a very obviously expensive city. But anyone who is below the poverty level would be eligible for Medicaid, and that's what we're talking about. Some of you were out yesterday, we saw all the signs. So we're about to talk about, just imagine what's about to come from the federal side and what our governor is doing here in the state. And home care workers, as Adria said, about 3/4 of them in New York City are immigrants. We know they're at risk. And I think most of them are, quote, legal because they're working through Medicaid, but they live in blended families, as we call them now. Some are undocumented family members and some are. They can get, as we see, they could get caught up. Also, it cuts off the pipeline for future home care workers, because that's, and that's part of the problem, is because it is a low-paid sector. We started with fair pay for home care. The next year, we went after the insurance companies that are the middlemen and reaped $3 billion in profit that could be used for wages and care. Hochul didn't touch them. I wonder why. And then about a year ago, around last May, it's towards the end of the state budget process and all, Hochul came up with an idea. There's this program, and actually, it's interesting what you said to me, Caroline, or what you, shared with the group, because it's called Consumer Directed Personal Assistance Program. And it's where a family member can get paid, a friend can get paid, they can hire their own personal assistants. You could have everything from a mom taking care of a disabled child, or a daughter taking care of a parent with Alzheimer's, and I saw this woman talk, she has hired a team of these personal assistants, which are very hard to find because the pay is very low. And this team, she has a disabled child, allows her to go out to work. So if this program falls apart, she's going to leave her job. What is she going to do? Just the ramifications. So the Consumer Directed Personal Assistance Program, it's called CDPAP, okay? That's the acronym. And yes, Rebecca, it was started by the disability community decades ago, that they should be able to direct their own care and hire their own workers. So Governor Hochul came out with this idea that there should be one central corporation in all of New York State that gets to administer the program. I'm not going to go into all the technicalities because it'll take way too long. But right now, there are hundreds of groups that do this, and she wants to give it to one, and she did. She pushed it through the legislature. She hired or signed a contract, $9 billion contract with a B. The name is PPL. They always have these, names like don't mean much. But PPL is being sued in Pennsylvania because people lost services and jobs. They've lost their contract in Massachusetts, in West Virginia, and there's a few other states. So why would you even consider them to come here? That's a whole political thing we don't have time for today. So they have a disastrous record. And people are terrified. You have a situation where, and mind you, New York State has the largest shortage of home care workers in the nation. There's a shortage nationally, and part of it is because we are a very highly populated state. And we are actually very generous with our Medicaid program. It's not perfect, it's been cut, but if you go to other states, we're probably one of the more generous states with it. But we're proud of that. We're really proud that we serve people in this state. It's not a mistake, it's not something to be ashamed of. So we got this word last May, a year ago, that as of April 1st, which is this year, coming up, this whole program was going to have to be transferred over to this one entity. I would just want to describe to you, and I'm glad Adria mentioned it. This has been a huge, first of all, what I did in my career, I worked for 28 years as a director of public policy with an organization called Live On New York, and they represent senior centers and Meals on Wheels and affordable housing, but not the Medicaid side. So a lot of this Medicaid stuff has been sort of new to me as well. And, but what this program does is it allows people to stay in the community. And they have formed relationships with these local groups, technically called fiscal intermediaries, with these local groups who pay the wages, who make sure their rent gets paid. They administer the program. Sometimes it's because they speak Spanish or Chinese, or you name the language. Here we are in New York City. This one central group, they can't even, it's like calling Verizon. You can't get somebody on, or you're waiting a half hour. You get somebody who's in another country, or sounds like they're in, it's like the service you get when they're in another country. I'm not going to disparage the country, but you all know what I'm talking about. But this is home care, for God's sakes. And it's interesting because we talk about bodily autonomy, of course, now with reproductive rights and all. What could be more personal than personal care? And if you have more than one worker and you have to keep training them over and over again. So this is really tough stuff. And I've learned a lot because I've gotten to work directly with disabled activists. And like everything else in the world, when you get to know people individually, everything changes. It just changes. My field was more aging. We weren't working directly with people who had, younger people who had disabilities. So we have this situation. Here's Governor Hochul saying, let's just give this contract to this one enormous private equity firm that has a miserable record. And let's do this. So how many people are we talking about? I don't know, a few thousand? Do you have any idea how many people we're talking about between the consumers and the personal aides? Guess, come on, guess. Millions. Well, not a million, but what? All right, well, you're not so far off in a way, though. 705,000 people. This is probably one of the biggest programs you've never heard of.
Oh.
And it's 425,000 workers, personal aides, and 280,000 consumers of care. And so she wants this huge transfer. And by the way, the states where PPL lost their contract, even Pennsylvania, which is a big state, is about this big compared to how many people are in their program compared to New York State. And so she chooses this terrible company. They can't give service, even if you want to transition over to the new PPL, they can't help you. Then they were starting to say, well, the consumers themselves have to do all the documentation. Some of them have pretty severe disabilities, and by the way, that's why we're paying you. So it just goes on. Somebody needed to speak Spanish. I joke that you can go on any street corner of New York City and get someone who speaks Spanish. They got someone who speaks Italian. You know, so it just goes on and on, but your life is hanging on this. You know, it is sort of, you laugh a little, of course you do, but their lives depend on this. Their biggest fear, they'll go into a nursing home, they'll end up in ERs, they be people with disability and illnesses, in hospitals, their family will fall apart, people will leave their jobs, and it's always the women. I'm sorry, men, it usually 90% who leaves their jobs are women. And so the ripple effect is so serious. And as Adria mentioned also, it's predominantly women of color and immigrant women. So again, the whole immigrant side. But it's also the whole, if Governor Hochul had her head on straight, if you gave these workers fair pay for home care, which is how we begun this whole thing a few years ago, can you imagine the economic impact in communities of color, for God's sake? They're raising their kids. They may be taking care of other people. They're active in their own, you know, communities where they live. This would be enormous for racial and economic justice. And what is she doing? She's pushing it aside. We want a small increase in the wage, and for 3 years now, she's tried to cut it back. It makes no sense, and it's bad politics, and it's very immoral. So here we are. April 1st is a deadline. You know it's coming up. So the immediate call for action is to call Governor Hochul. Now, I know you're all calling Gillibrand and Schumer and me too. But again, this is the biggest issue I know of that nobody will ever take to the streets on. And so please, and I can give you a number now, you obviously could Google it, but if you want to write it down, Hochul's number, here you go. And I'll give you a little hint about getting in to leave a message too. She has a very long message, which I think is meant so you don't leave a message. It's 518-474, I'll say it a few times, I'm sorry, 474-8390. So 518-474-8390. Now, if you hit 3, you bypass the message. If you hit 2, you leave a message. If you hit 1, you wait for the agent, but I wouldn't bother. So if you hit 2, you can leave a message.
Bobbie, we have these flyers here also.
The flyers were handed out. Unfortunately, I think I didn't put Hochul's number on that.
And also,
So-
I'm going to ask Pat to put that in the chat for people who are online.
So let me, you know, I know there's a lot more I can say, and if you have any questions or comments, I would love to find out if anyone in the audience here today is familiar with this program, because I think it's pretty common. But the caring economy, this is Women's History Month, it's us. This is not to disparage men, but this is a reality. It's the women. It just is, not only in this country, but all over the world. And home care is the work that allows others to work. For a hot minute, we had Kamala Harris saying that home care should be covered under Medicare. I jumped up and down in my apartment when she said that. And here's my slogan, which you can steal if you want. Feminism does not end at menopause, period. And ain't that the truth?
Down. Right. I want to make sure that we hear the range of the work that happens at Cooperative Home Care, which is not the CDPAP, I believe, although it might be some.
No, it's more than that.
But it's much more than that. So I would love you, Adria, to speak in whatever way you want in terms of how these different constraints, thanks to our public policy, are impacting the work that the many women predominantly do with cooperative home care and home care services.
Yes, thank you for that, Rebecca. So Cooperative Home Care does do about 20% of our business through the consumer directed program. The balance is mostly our traditional licensed home care service agency, which it requires a training program because in the consumer directed program, it is the client who is directing their own care. And on our traditional LIXA side, we have to follow the New York State Department of Health regulations. So there's a training program. CHCA built its own training program in conjunction with our sister organization, PHI, back in 1986 or 87. And what we've done is to create really a nationally recognized training program that focuses like on adult learner-centered education principles. We go above and beyond what's required by New York State so that we can really ready the training participants to be successful in the role of a home care worker. We do a small amount of private duty services, which is, when someone either has long-term care insurance or they're able to pay out of pocket, but it's quite rare because the cost of, the services, when you are charging what it costs to really have a worker have decent wages, decent benefits, paid time off, holiday pay, overtime at time and a half of base wage, because that was another piece that not until 2000, the legislation went in 2010 and got passed in 2015 for home care workers to actually make overtime. Meanwhile, CHCA from our very, very first year was always paid time and a half of base wage when workers were working overtime. So, we do small private duty, and we're actually now getting ready to go into respite care services and have an application to provide care at the city level as well. And largely, I mean, the challenges that we're up against, not only, with the consumer directed program, it will mean like the loss of 20% of our business, but the vast majority of CHCA services in either of those programs, and even in both of those programs, comes from Medicaid. So the threats to cutting the Medicaid budget are really alarming at the federal level. And it's particularly alarming because whatever hole gets opened by what the feds cut, you would think would be filled by New York State because New York State has this commitment to Medicaid. But what we've been seeing over the past several years is an erosion of that. And so, we have grave concerns that if that Medicaid budget gets cut, the state is not going to look to fill those holes. And then that means less access to care for people. That means not investing in wages and benefits for workers when we know that we need to improve the quality of the jobs if we are going to be able to meet the demands that the workforce shortage has created. And early on, Rebecca had shared that we stand as the largest worker-owned cooperative in the United States with 2,000 home care workers. That number dropped. That number dropped when COVID hit. Many, many agencies lost workers. And so today, CHCA has 1,600 home care workers. And we continue to try to, build that number. And we are able to attract people to our training program, but there's still, a huge shortage.
I'd also want to add that one of the things we're hoping, the state doesn't do, but we know there's been some discussion, is they can make it harder to get on to home care.
Mm-hmm.
So right now you need 2, what they call activities of daily living: bathroom, eating, showering, etc. They could make that 3. And then what happens sometimes is somebody doesn't get onto Medicaid-funded home care, then they fall, and then they get onto Medicaid-funded home care. And who takes care of them in the meantime? So there's many ways of cutting this, and since Hochul definitely has no, she's not supporting home care, that if Medicaid cuts, or when they come down, this is not a place she's going to look to fill any holes. In fact, this whole move with this consumer-directed program, the Department of Budget, who pulls numbers out of a hat and never tells us where they get them, by the way, says there's going to be $500 million of savings, half state, half federal. It could be, because if thousands fall off the program and people lose their jobs, you could say 500 million. I know these are big numbers, but you could say $500 million. So we don't see her as making home care. I think she's using home care as a bank. She's not going to give, the state's not going to give that 500 million back to the feds. They'll just put it elsewhere. And also, what I didn't mention, Adria, was the state legislature, because we do have a state legislature, you know? So, and they haven't really liked the Assembly and Senate. Most of the members we talked to haven't really liked this idea since it was introduced. However, as you probably know well, because we have a room of activists, what does the leadership think? It's not just the members themselves, your assembly member, your senator. And the head of the Speaker of the Assembly is Carl Hastie. He's from the Bronx, you may know his name. And Andrea Stewart Cousins is the majority leader of the Senate. She's from Yonkers. And they've been very quiet, the leadership, not the members themselves, but they've been very quiet. They just introduced something they call a one-house budget. The Senate does a budget, the Assembly does a budget, and you hope your issue gets into that budget, and then they negotiate. CDPAP did not make either one. And that's the first year, because the last few years home care has made it in. And they're all just folding and they're playing a game of chicken. So April 1st, and in this technicality it's really March 20th, because you have to have your ducks in order before April 1st, it's going to collapse. And we don't know what to do. And we just keep saying, you have a deadline. Albany's not used to a deadline. You have a deadline. I've been doing this, as you can gather, for decades and decades. This may be the most egregious thing in one fell swoop I've ever seen happen to a program. Did somebody,
Adria,
did you raise, oh, sorry.
Yeah, Adria, I want to see if you want to say a word or four about the dire situation we're in, and then we could take some questions if there's time. Yeah.
Yeah, I mean, I think, exactly what Bobbie is saying. We are a week, 11 days out from the deadline. And the sheer numbers of consumers who need to be enrolled and the number of workers that need to be onboarded and the percentage that have come through the process already is alarmingly low. So when we get to March 28th, there's a deep, deep fear that hundreds of thousands of consumers will not have services. Hundreds of thousands of PAs will go without paychecks for 4 weeks, 8 weeks. And I'm sure everybody can imagine for our home care workforce to not have wages they can count on for a week is critical. It will be a catastrophe.
If you do the math, because I did this last week, because this is what I do, this was about a week out, they would have to sign up 16,000 people a day just in New York City. Go figure. Yeah.
It's awful. So PPL, the PP is public-private LLC, and I think it's important to realize when those services that belong in the public are privatized, look at the catastrophe that we see. Yeah. That's a political sort of framework, but the practical framework that stems from that is that how many people will suffer.
So if they have any questions.
So yes, questions in the room, and Pat, let me know if there were questions in the chat.
I'm just curious if the governor gave a reason for proposing this new entity?
You know what? I am so
I know
glad you
it's-
brought that up because I forgot to say something really important. It's probably not the answer you might think. So Bev, in Together We Can Move Mountains, there's that lyric that says that they abuse us, confuse us, and then they blame us. So what came out of the governor's mouth at the very start of this is waste, fraud, and abuse. Who does that sound like? But your lyrics are spot on, except you wrote the song 50 years ago, right? And bless you for doing it, I'm just saying. But no, she claims they're going to save millions of dollars and there's waste, fraud, and abuse. And there was a Medicaid Inspector General study that showed a few years ago that there was $46,000 worth of abuse. There's no program that has only $46,000 worth of abuse. But it showed that the insurance companies, the middlemen, there was fraudulent payments of millions of dollars.
I have two questions over here.
Oh, this makes me cry, and I know a lot of people who are involved in this, but I can't leave this room without saying, and probably most of you know about this, that there are 1 million people in this state that have no health insurance. There are 744,000 who have insurance who are in medical debt, just to add to the sadness that Bobbie is talking about. And probably most of you know that there's legislation called the New York Health Act, which covers everyone in the state and which includes long-term care. And
Which we fought for,
1.8 million now, but we're all going to be in that category. And who's going to take care of us and who's going to pay for it? I walk around all the time with flyers about the New York Health Act. So I put a couple on there because people have a lot of questions about the funding and all of that. But if you're calling Kathy Hochul and your assembly person or your state senator, tell them we need the New York Health Act, that 32 out of 33 industrialized countries have this. Ain't gonna happen in the United States this year or in the next couple of years, but it can happen in New York State. Sorry, I'm not asking a question.
No, that's okay, because it's all connected, and I've been urging you to call Hochul, but obviously you should also call your state senator and assembly member, preferably in the Albany office, even if you just leave a message about, just say extend the deadline for CDPAP. That's it. That's all you have to say, CDPAP. Yeah.
Well, that was my question. What do we say to Governor Hochul?
Extend the deadline for CDPAP. And if you want to add, why are you dealing, why have you signed a corrupt contract?
So the deadline can be extended?
Yeah,
That's the immediate remedy.
that's the immediate remedy. Then it's all the other problems you've heard something about. But that's the immediate remedy.
Pat, any questions in the chat? And then I'll come to Tom. I just want to check on Zoom. Okay, Tom, and then I'll come to you.
Hi, I was very actively involved on the computer system side with the implementation of Medicaid managed care for the foster care population. And in that effort, it was done as a partnership between the state on the one hand and voluntary agencies, SEO Family Services, Mercy First, New York Family, outfits like that. And the expectations were that the nonprofits would use their systems, the electronic health records, to help implement this. And it wasn't this kind of unilateral thing where they pick a computer system off in the next county to go ahead and take care of that. And there were multiple postponements, well over a year, in implementing managed care. So I'm not seeing the cooperation with the nonprofit community on the computer system side, and I'm not seeing the postponements. I mean, saying the thing has to be up in April seems totally unrealistic. And just wondering, were there computer systems coordination discussions regarding any of this? They just
You got the wrong one here.
Right? Okay.
Yeah, no, I can answer that. I can answer that by going, by shifting 700 fiscal intermediaries to one fiscal intermediary. everybody is forced to use that PPL's system. So there are authorizations that have to go from the managed long-term care plans into PPL system, and all of the consumers, all of the home care workers must be enrolled in their system. And that just started in January. And there's been challenges, which is why it's taking so long to enroll everybody and have systems checked to see if they're ready. Payment systems, like payment from the plans to PPL, PPL paying to the workers. All of that is still not entirely tested out. And we're 11 days away from this transition.
Yeah, I would love to talk. Yeah.
Just a really quick question. When you said they would have to enroll 16,000 a day between now and April 1st, on an average day, how many have they enrolled? You told me that about a month ago. I can't remember the number.
I don't know. Yeah.
Maybe I have it wrong.
But if they're that far out, you know,
Yeah.
There actually is a chart somewhere, but I don't have it in front of me.
There's no way they could do that, though. There's no way they could enroll anything close to that.
No, they can't.
And so people will lose care. People will leave their jobs because they won't get paid and they have to pay their bills. It's just a total
It's a wreck.
shit show.
Okay. It's a total shit show. And I imagine, you know,
And this is
how
called
can
public
people show
policy.
up to organize? I'll take one last question from Ellen, and then we're going to go to our last song.
Oh, sorry to interrupt, but we do have a question on Zoom, if that's possible too.
Go ahead.
Go ahead, Ellen.
Should I go first? Okay. So I just wanted to point out, it was something very interesting. You guys have actually had an impact in that they spent an awful lot of tax dollars buying commercial time to call you.
Yeah.
Millions.
Yes, millions of dollars in tax dollars to call you liars directly. They said the word lie, and I haven't seen that one in a while. So that's
The fact that they even did it.
yeah. The fact that they even did it shows you the power that you all have, and that you scared them enough that they did that. So I want to thank you.
Oh, thank you.
One more question from Gail Johnson, who's a regular visitor on our Sundays and a member of New York City Network of Worker Co-ops. Gail.
So much, Rebecca. I don't have a question. I just want to give appreciation to Bobbie and Andrea for the work that you're doing in this field. I also appreciate Rebecca a lot for fostering these conditions, because we know there's a high percentage of aging population in this country. And I've also been a care worker at one time. I took care of a family in Long Island and many other different ones in the home care industry before I got into childcare. So please continue to fight. We do appreciate the hard work that you do in supporting workers like me and others that I'm familiar with. So thank you so much for your hard work.
Thank you, Gail.
Thank you, Gail. Thank you.
And then with that. So, yes, that's perfect, Gail, for you to be the final commentator as someone who works in this broader segment of care with children. And let me say now, we have another song, which is a bookend to the song that we heard at the beginning. And please welcome the Brooklyn Women's Chorus again.